Thank you. Namaskar. This is Dr. Alok Roy from Calcutta Medica on our weekly seminar series, Health is the Ultimate Wealth. Like every time we try to bring something different, something which can be useful to you in your day-to-day life, which can save you a lot of trouble, which can give you health, some tips, which is good for your health, because we believe that health is a prerequisite for anything in life. Today, we have with us Dr. Sanghamitra Chakraborty. She's our senior most dietitian. She has been with us since Medica's inception, and she's very knowledgeable, speaks very well, has a great knowledge, and how does the diet work. And while I was talking to Dr. Pradipta Sethi last time, you heard him 2 weeks back. We talked about the digestive health, gut health. We realized the role of diet is huge to our mind. And it's not just a gut health. It's you as a healthy person, the gut plays a very central, very pivotal role. एकदम बीच में है, आपके स्वास्थ्य के संबंधित हर बीमारियों का इलाज आपके गट में है. When we realized it, it was like a dawn of knowledge, and we realized that how much we don't know. As a doctor, how much we don't know. And with that, we connected with Sanghamitra, and she has got a beautiful presentation. I've already heard it, and I'm sure you all will benefit. Without wasting time, over to Sanghamitra for her presentation, Gut Health and Diet. Sanghamitra, over to you.
Namaste. Very good evening to all of you. Welcome to you all on the show. So today I'm going to speak on the importance of gut health. As all of you can understand, we dietitians are very, very concerned about a person's gut health, not just because it deals only with the digestion and absorption of food. Naturally, you would associate a dietitian with food and the gut, but the gut is also responsible for other things. For instance, our immunity also depends largely on our gut. We talk of immune-enhancing diet, especially after the COVID pandemic. Lots and lots of queries have come into us. How should we improve on our immunity? What should we eat which will magically benefit the immune system? But there is no magic pill as such. What you need to do is that you need to build up on a healthy gut, because the gut happens to be the largest immune organ in our system. So if we keep our gut clean and healthy, automatically the immune system works fine. So typically the gut health is important, not just for the nourishment of the person, not for just nourishing you, keeping you alive, making you fit for work, but also to enhance your immunity and keep you a very healthy person. And this is not just said by the dietitians, the doctors also agree. And it was said long back by a scientist, a philosopher, a physician. He's supposed to be the father of modern medicine, Hippocrates. He lived in Greece several centuries before Christ. At that time, he had said, all disease begins in the gut. We have also heard our seniors tell us when we were young that keep your gut clean. बच्चा ठीक से खाना खाओ, पेट साफ रखो, सब कुछ ठीक हो जाएगा. तो हम लोग चिढ़ जाते थे, क्यों इतना साफ रखना है, पेट अच्छा खाना खाना है, फ्राइड आइटम्स खानी है, चॉकलेट्स खानी है, क्यों दाल चावल ये खाए. But the fact is that that is a secret of good health. Our forefathers, what they did, they concentrated on healthy homemade food, and the food that they had were essentially of organic origin, free of pesticides. The air was less polluted, so we had a healthier ambience. Automatically our guts used to be healthier, and so we were free of disease. With the modern times, we are now hooked on to fast food. We have erratic feeding patterns. We don't eat on time. We have the habit of skipping meals. And the food that we now take today is not at all free of pesticides. They are full of additives and preservatives. So all these have somehow contributed to an impaired gut health. And that is responsible for many kinds of disease, including an impaired immunity. So typically, if we look at it, what are the factors which affect gut health? Is it only the diet? No, stress is also important, because stress creates certain changes in your system, some hormonal changes. Our body is interlinked. One organ is linked with the other. Nothing works in isolation. So if you have a high level of stress, automatically the gut is also going to get affected. There's going to be more secretion of acids and so on. Similarly, mental health is also important. It's very commonly known that when you are depressed, you eat more. So many people have eating disorders. That affects the gut. Diet, of course, is important, but so are sleep and exercise. A person who exercises regularly, who sleeps on time, will automatically give the gut proper rest, and it's going to be able to function properly. But now with the advent of modern technology, we are all used to staying up very late at night. We are hooked onto our mobiles and computers. That has somehow disturbed the circadian rhythm, for which we also find that some effect is coming on the gut. It doesn't function that well as before. Definitely our genes are responsible for what we are. And apart from that, a very, very important part is the gut microbiome. It is basically the bacteria which thrive in our gut. It is said that there are more bacteria in our gut than the number of cells in our body. And these bacteria in our gut, they basically define who we are. So I am Sanghamitra today because of the kind of bacteria in my gut, not just my genes. So depending on whether you have a healthy group of bacteria or a pathogenic group, depends on that, how you behave, how much of illness you have, what is your immune system, how your immune system is going to function, and how you're going to be as a person. So more about this later on, but what you can see is that there are so many factors which affect gut health. And typically, when the problem starts, they start with very recurring, irritating problems. A loss of appetite. People come and say, "Kuch khana acha nahi lagta, kuch bhi dil nahi karta, swad nahi hai." No matter how tasty you make the food, the family members tell us, "Sabhi to theek hai, we make the food tasty, we give variety," but the person will complain, "Khana acha nahi lagta." Flatulence, there's a lot of bloating and gas problem, and this part of the country in eastern India, particularly the Bengalis, we are very, very complaining about the gas symptoms. We are very obsessed with the gas problems. It's partly to do with the way we eat, which I'm going to discuss. You can also have more difficult or more serious problems like the blood or mucus in your feces. The patient can complain of weight loss, unexplained weight loss. You are eating, but somehow the weight is not, you're not being able to maintain your weight. Abdominal pain, discomfort, vomiting, constipation, all these are signs and symptoms that your gut is not healthy. So what do we do about it? One by one, we are going to discuss the problems. We start with a very common problem, indigestion, also known as dyspepsia, or commonly we call it upset stomach, acidity. People say, "Jo bhi khate hai hum, jalan hoti hai." We can't digest it. Dakar aata hai. Take the belching or the burping problem. It's very, very common in people, and that is the reason why we go on taking antacids, we pop in antacids, we go for 100 kind of therapies, but we do not think about the diet. So this typical feeling of abdominal fullness, something getting stuck in your throat, heartburn, acidity, all these things are a result of not eating properly or not spacing out your meals. If you skip breakfast, if you do not eat anything throughout the day and you go for a very, very heavy dinner, automatically you tend to overeat. So when your stomach is wanting food, you are not giving any food. So that is a cause of acid regurgitation. The stomach is crying for food, you're not giving it food. But at the same time, when the stomach is getting food, it is overburdened with food because you're overeating. So automatically the acid secretion also steps up to keep pace with the increased amount of food, and there is an increase in the acidity. So not eating on time, not spacing out your meals on time is one very big cause of this acidity and problem, as also is the ingredient of your diet. Very thick gravies, deep fried items, difficult to digest foods are the ones which cause acidity. There are some carbohydrates, we call them fiber-enriched foods. Fiber is not really digested in our stomach. Fiber is meant for stool formation, for keeping our gut clean. It is important that we take fiber, but you also have to understand that if the fiber is not spaced out in your diet, or some people, if they are not tolerant to too much of fiber, especially the elderly people, the geriatric patients, what happens is that this fiber, it passes out into the large bowel, the colon, and it gets fermented by the bacteria. There's excess production of gas. And this is particularly found in elderly people who have restricted water intake. So without adequate water, with excess of fiber intake, you can also have an aggravation of this problem. So the secret of removing this problem, of avoiding this problem, is eat your food on time, have regular meals with fixed proportions at each meal, do not eat very late into the night, and judiciously choose your fiber. Next is the problem which we call GERD, gastroesophageal reflux disease. It is a little more severe and troublesome because it can happen due to a lot of reasons, not just the diet. Somebody who is lying in bed, elderly people who are not mobile, or some structural deformity, like people who have hiatus hernia, a structural problem where the stomach kind of moves up to the above the diaphragm, so that exerts pressure on the esophagus. So these kind of people can also have this problem. So if you are not very mobile, especially if you are an elderly person, obese, with abdominal obesity, and of course wrong eating habits like taking in too much of coffee, having long hour gap between your meals, going to bed right after your meal, smoking, you are likely to have this problem of GERD, which is a very recurrent and bothersome problem, but easily avoidable. A lot of medications are given to treat GERD, but unless the diet is amended, we will not get any results. So eat on time, eat small amounts. The person with GERD has to have a small portion of food so that it gets digested and it moves down the bowel easily. Another secret is of managing this disorder: do not go to sleep immediately after food and do not drink too much of liquids or water. So many people are under the impression that if I take a lot of water after food, that will hydrate me well. Some people who are very diet conscious, what they do, they drink a lot of liquids before the meal, including water, so that they don't overeat at the meal. But what we tell them, that if you do this, what is happening is that you are actually diluting your gastric juices. So the food is not going to get digested, and very probably you're going to have a reflux. So it is important that you eat small meals, chew your food properly, do not have too much of liquids just before or after taking your food, avoid going to bed immediately after eating, and avoid things like smoking and taking too much of caffeine. Now, the next very recurrent irritating problem, which I think everybody has suffered sometime or the other in life, is diarrhea. Everybody has diarrhea. Doctors, dietitians, all of us have had diarrhea at some time or the other in our lives. Now, how serious can this be? If it's an acute case of diarrhea by eating some kind of a food poisoning or eating some kind of a toxic ingredient, or you're suffering from, say, a traveler's diarrhea, you've gone to a new place, a new ambience, you've taken water which is not from a healthy source, or you're not suited to the climate or the food out there, it is very common to have diarrhea. Usually acute diarrhea is infective and it is self-limiting. But the problem is that people stop eating when they have diarrhea. Khana band nahi karni chahiye. Because when you have diarrhea, your body is depleted not just of fluid, but also of vital salts. So the biggest problem you face if you do not eat when you have diarrhea, or you do not hydrate yourself well, is dehydration. तो आप लोगों को हर वक्त ये याद रखना चाहिए कि खाना बंद नहीं करना है. अगर पेट खराब है तो डॉक्टर से बात कीजिए, क्या खाना है क्या नहीं खाना है पूछ लीजिए, हल्का खाना लीजिए, दाल चावल लीजिए, दही लीजिए, नारियल पानी लीजिए, नींबू पानी लीजिए, शिकंजी ले सकते हैं. कुछ हेवी फ्राइड आइटम नहीं खानी है, लेकिन खाना बंद नहीं करना है. स्पेशली एल्डरली पीपल, बुजुर्ग आदमी जो होते हैं, उन लोगों का प्रॉब्लम ज्यादा होते हैं. ये जो नमक जो होते हैं हमारे शरीर में वो निकल जाते हैं. So they can become drowsy and a lot of complications can take place which may or may not be able to, people may not be able to manage at home. So you should not stop eating when you have diarrhea. It will go on its own. You just need to be a little careful and keep in mind the hydration. But what if the diarrhea is chronic? If it is chronic and lasting for more than 4 weeks, or you are having some abdominal discomfort which is not going away, if there is blood in your stool, or you're having persistent weight loss, in that case, you need a thorough evaluation. Typically, the diet in diarrhea would be low in fat, avoid fried items. Too much of protein a person may not be able to digest, especially if it is not from the lean source. So thick gravies, Absolutely, high fat containing protein items should be avoided. Processed items should definitely be avoided. Insoluble fiber rich foods are not well tolerated. So if you take a lot of high fiber food like vegetables and whole grain cereals, you might find that the diarrhea is getting aggravated. So for a temporary period, it is better to have some food which is low in insoluble fiber but high in soluble fiber. Rice-based diets work very well in diarrhea. So typically rice, some lentils, soup in the form of soup or some thin lentil, dahi, curd, some light vegetable. This is the kind of food which we can have in diarrhea. And we have to keep in mind that adequate fluids have to go in our system for the proper correction of electrolytes as well as hydration. So typically things like tap water, shikanji, sattu pani, soups, homemade soups, lassi, all these things can be taken to control to keep in mind, to control the hydration and correct the electrolytes. And remember, lactose and gluten are not well tolerated. So typically milk is to be eliminated from the diet, but it is absolutely safe to have curd or chena. Because in the curd, we find that it is basically not lactose, but lactic acid which is present because of the action of the bacteria in the curd. So it is absolutely safe to have curd, but gluten, or that's a kind of thing, it's a kind of protein which is found in wheat products. It is not well tolerated in diarrhea. So temporarily, even the people who are used to having wheat products can change to a rice-based diet to get good results. Now, the opposite of diarrhea, constipation. It's a very, very common problem, particularly in the elderly who are not mobile, who have a lot of medications, polypharmacy that can also lead to constipation, lack of hydration. All these things are responsible for constipation. So first and foremost, it is very important to increase the intake of fiber in our diet. As I said, fiber can be of two types, soluble and insoluble. We cannot always define separately that, okay, this food has only soluble fiber and this food has only insoluble. They usually blend. But as a thumb rule, fruits and vegetables are a high source of soluble fiber. Oats have a lot of soluble fiber. Barley has a lot of soluble fiber. They have something called beta glucan. It's a fiber which not only helps in stool formation, it also helps to lower cholesterol. It has a dozen activities. It's cardioprotective. It protects us against cancer and so on. But at the same time, insoluble fiber is also found in oats and in all kinds of cereals, all kinds of whole grain cereals, dals, chilke wali dal, aate ka cheese, gehu ka cheese, brown rice. So all these have a lot of insoluble fiber. A combination of soluble and insoluble fiber actually helps with constipation. Along with that, it is important to exercise, to stay hydrated, and fried items, salted items, processed items, things like maida, which do not have fiber, fast food, which are processed without any fiber, they have the chance to increase the risk of constipation. So a person should stay away from it. So we usually have these problems of diarrhea and constipation. They are nagging issues, but they usually do not turn out to be very serious. We can control it through diet, exercise, and maybe occasionally we can take in some medicines. But what if we have a more recurrent and a more serious problem like IBS, irritable bowel syndrome? Usually people who have irritable bowel syndrome, they have it for life. They have flares. So occasionally you will find that the thing has increased. The person is having either severe diarrhea or the person is having severe constipation. They're not able to eat anything. And at other times they go into remission when they say, okay, fine, now we are feeling better. It actually depends on the degree of inflammation in the person's system. So the first thing that we need to do is reduce the inflammation in the system. And how do we do that? Apart from taking anti-inflammatories, it is by avoiding the inflammatory triggers. There are certain foods which actually increase inflammation in our system. The first which comes to mind is sugar. We all love sweets. We have sugar. We don't think about how much of sugar we are having, especially if we are non-diabetics. But sugar is an inflammatory trigger for all diseases. So if we avoid inflammatory triggers, it can differ from person to person. The person needs to identify and avoid the foods that are actually triggering inflammation in his or her system. And we can do another help to these patients by reducing the amount of fermentable substrate passing into the colon. So the food that we are having naturally has fiber. So what is not digested is actually fermented by the action of bacteria in the large colon. It is absolutely natural. It is beneficial, it happens. But when the fermentation goes beyond a limit, when it happens in excess, it is then that the problem starts, gas and discomfort, diarrhea, and so on. So we know that if some people with IBS who have typically they are prone to diarrhea, they need to control the amount of insoluble fiber that they have. There are some vegetables which have a lot of sulfur producing compounds in them. Like we know radish, spinach, saag, mooli, all these things we know they have, typically people say gas hota hai. Cabbage khane se humko bahut gas hota hai. Phool gobi, patta gobi hum nahi kha sakte. I don't digest saag because typically they have a lot of insoluble fiber and also soluble. But along with that, these vegetables like your gobi and mooli, they have this sulfur containing compounds which the bacteria act upon in the large bowel. So that leads to a lot of discomfort and it can actually aggravate the IBS. So what do we do about it? Typically, the dietary management will depend on what the person is going through. Does he have a constipation predominant problem or does he have a diarrhea predominant problem? If it's a constipation predominant, we not bother about all these things. We can give him lots and lots of fiber in the diet, very simple. Ask the person to have a lot of soluble as well as insoluble fiber. Vegetables, fruits, advise them to have whole fruits, not fruit juices. Because fruit juices, we are removing the fiber and we are actually concentrating the fructose in the system. So that will not help. So we need to eat whole fruits. We need to eat whole grain cereals, dalia, oats, whole wheat products, whole grain rice. Like in Bengalis, we have something called atop chal, gobindabhog chal, that is milled refined rice. People love it. Everybody likes basmati rice, but it's not actually that healthy because it is refined. At the same time, if we take what is known as sheddo chal, parboiled rice, or even the brown rice, that has got a lot of fiber, that is definitely healthier. Okay, so a lot of fiber with adequate hydration will manage this very well. But if the person has a diarrhea predominant problem, in that case, first of all, we avoid the triggers. And what are the typical triggers? Excessive alcohol, caffeine, carbonated beverages, high fried processed items, too much of fiber in this form of insoluble fiber through whole grain cereals. It's just the opposite. They have to avoid the whole grain cereals. They have to avoid too much of legumes which have a lot of fiber. They should choose wisely on the kind of vegetables that they have. So they should concentrate on soluble fiber, fruits, barley, oats, carrots, this kind of apples, bananas, your guavas, apricots, nashpati, pears, all these have a lot of fiber that will help in stool binding. And the triggers, things which are difficult to digest, processed items, fried items should be removed from the diet. So that is how we manage the irritable bowel syndrome. And sometimes we find that the patients have a combination of both. They are alternating. So depending on that, the diet has to be modified. And remember that stress can aggravate irritable bowel syndrome. So people who have IBS should typically try to manage their stress levels and they should not binge eat. By binge eat, I meaning they go out to a party and they eat too much of fried food or they eat too much of greasy items or taking too much of alcohol, too much of caffeine or carbonated beverages. They actually serve as triggers and aggravate the IBS. Now I come to the concept of FODMAP. This is a very new concept. A lot of work has been done on this. FODMAPs is nothing but fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. These are basically names of different carbohydrates. So the food that we are having, it naturally has a lot of carbohydrate. And these carbohydrates, what happens is that they behave in our system in different ways. So if we take in excess fructose, some people say fruits are very good for health, take a lot of fruit, but nothing works in excess. Too much of fructose, like if you take in fruits which are very high on fructose, like too much of apples or pears or peaches or the very favorite mango, which is coming into the market now, what happens is this excess fructose can lead to abdominal gas and distension. Similarly, fructans, they are found in wheat products, in onions, leeks, which we commonly eat. Moderation is fine, but having it too much does not help. Sorbitol is another item, a polyol, which actually aggravates IBS. And sorbitol is very commonly found in all these preserved drinks that we have, the fruit juices which are sold commonly in the market, or even these sugar-free, labeled sugar-free fruit juice, sugar-free carbonated beverages. People think that they are avoiding sugar, so they're actually having a very healthy stuff, but they are not. Usually sorbitol is added to it. Even the diet mithai that you get in the market, the diabetic sandesh and the diabetic mithai, people think, or the diabetic iced tea, people think that it's very healthy because it is sugar-free, but no. What is happening is that sorbitol is added to it, and sorbitol is not at all well digested by people who have IBS and who have stomach issues, because the sorbitol, it is fermented by the bacteria, and it can cause a lot of gas and flatulence and also diarrhea. Even a healthy person who has an excess of sorbitol can have diarrhea. Raffinose is found in leafy vegetables, in fibrous vegetables, in lentils. So all these things combined, they come under what is known as FODMAP. And the idea is that IBS patients should gradually introduce these in the diet. You cannot completely avoid all of them, because in that case, your diet will become very restrictive. The idea of introducing this was to help the patients identify which foods can aggravate their problem and gradually eliminate or reintroduce them. So there's a way of doing it. You just don't stop everything for life. What you do is during the first 2 to 6 weeks, you eliminate all these things. You see whether you get any improvement or not. If you do not get any improvement, we have had people who have said that, no, we have not benefited from FODMAP. It is not that it's a golden answer to all problems of IBS. So if you do not get any improvement, you can start everything again. But some people have benefited. So what is being told to them is that in the second phase, you gradually start introducing one food, one FODMAP item at a time, and see how your body gets accustomed to it. And in phase 3, you really know which are the items which are aggravating your problem. Say the apple is aggravating, but probably the guava is not. So you can actually define the food items which are acting as triggers for your system, and you can eliminate those food and either not reintroduce them or try and reintroduce at a later date. So this is one way of dealing with IBS. Now I come to our next rather common problem, that is celiac disease. So there are two things. One is gluten sensitivity and the other is celiac disease. Gluten sensitivity typically means the person has an allergy to gluten. Gluten is wheat protein. So these people, they complain of pain and all kinds of rashes and itching problems once they take in any wheat product. So all they have to do is avoid the wheat products. And when we are talking of wheat products, we have to remember it is not just atta. हम आटे का रोटी नहीं खाते हैं, लेकिन हम मैदा खा रहे हैं, हम बिस्किट्स खा रहे हैं, हम केक खा रहे हैं, ब्रेड खा रहे हैं, वो भी तो गेहूं से ही बनता है. That also has got gluten. So we generally tend to overlook the bigger picture. Even certain health drinks which are sold in the market has gluten in them. It is very important for people who are sensitive to gluten to check all the food items before taking it. And just avoiding gluten works wonders for them. They have to keep gluten-free diet regime for their life. But if the problem is to do with celiac disease is a more difficult to deal and a more serious problem, because the person has to be absolutely free of gluten throughout his life, because the celiac disease, the patients can have other problems apart from gut-related issues. It's a more serious problem and it involves the entire system. It's a systemic disorder. And it can also make the person really sick. A person who has got just gluten sensitivity will have a very brief period of discomfort if he or she is taking the wheat. But the person who has celiac disease can actually land up in hospital if the person is not avoiding gluten. So these people have to be very serious about their diet, but all that they have to do is avoid wheat products, keep a diary of the things which can have gluten and avoid them. And for people who do not like a rice-based diet, they can now check online. There are plenty of gluten-free wheat products available in the market. जिन लोगों को चावल पसंद नहीं है, अगर चावल नहीं खानी है, आपको जबरदस्ती चावल खाने की कोई जरूरत नहीं, थोड़ा खा सकते हैं, लेकिन आप इंटरनेट पे चेक कीजिएगा, आजकल मिलता है ग्लूटेन फ्री रोटी, ग्लूटेन फ्री आटा, ग्लूटेन फ्री दलिया, सब कुछ मिलते हैं. So you can go for that. In that case, you will not have this aggravation of your symptoms. So dietary management in celiac disease is not a very big issue. It is just that you have to avoid the trigger in your system, that is gluten. Okay. But now we come to a more serious issue that is called Crohn's disease. This comes under the broad group of ulcerative colitis and Crohn's disease. They are a little more serious than the others that I've mentioned before because they are systemic disorders. So typically in Crohn's disease, you find that the manifestations may not be just in the gut. The person can start with having some kind of an abdominal pain or diarrhea, ulcers in the digestive tract, or it can be an excessive pain in the joint. The person comes, I've got joint pain, probably thinking the person is an arthritic. We can refer the person to an orthopedic. But ultimately it is found that the problem is due to Crohn's disease. It's an autoimmune disorder. So it can attack any part of the body, but ultimately the main target is the gut. So we have to protect the gut. Unless we protect the gut, what happens is that there are extra gut manifestations and other organs are also getting involved. Now, the biggest problem of people who have Crohn's disease or ulcerative colitis is that they are malnourished. We do not usually find people with celiac disease so malnourished as we find in the case of ulcerative colitis and Crohn's disease, because it affects a lot of organs. And these people, they usually come not just with malnutrition in the form of reduced calorie intake, reduced protein intake, they also come with vitamin deficiencies because the gut absorption is also impaired. So typically angular stomatitis, lesions in the mouth, that can be due to vitamin B deficiency. The vitamin is not getting absorbed into the gut. So these people, they need to really alter their diet and need to keep a diary and account of what they are eating and what are the triggers. Because these things cannot be cured just by medicine and they require a follow-up lifelong. For a person with Crohn's disease, the advice that we give is first and foremost, have a lot of water to keep yourself well hydrated and prevent constipation. The more constipation you have, more toxins in your gut, and that can actually aggravate the problem. Multivitamin, minerals, and supplements may be required to replace lost nutrients. For a person who is eating a healthy, normal diet, we do not need to have any extra pills from outside. Although nowadays it's very, very fashionable, people take in a lot of pills and supplements from outside saying that, okay, this is going to boost my immunity or it's going to do wonders for my skin or health. It really doesn't matter because your food is the source of your multivitamins and minerals. And if your system is working fine, you get it naturally. But for people with such disease who have a problem in the absorption of the normal food, for them it is very important that they take in some supplement. But remember, these supplements are to be taken only under the instruction and supervision of a clinician. Even a dietitian is not allowed to prescribe any multivitamin or multi-mineral capsule. We can only do it through diet and maybe supplements, but not as tablets. So if you think that your patient or your loved ones or even you are having the problem and you need to take some supplementation, you need to do it under strict medical guidance. Now, what about fiber? We find that these people, they do not always tolerate a lot of fiber. So only when the person is not having a flare-up, acute manifestation of the symptom, when they're having diarrhea or abdominal discomfort, in that case, they need to go low on the fiber. They might have to have a bland diet for a few days. But when there is a remission of the symptoms, they can slowly introduce fiber in the diet. It really differs from person to person. If we do not give them any fiber, that will also create damage. But at the same time, excess fiber can actually aggravate the system. So what we do, we tell them usually to concentrate more on soluble fiber items and limit insoluble fiber. Lactose is not well tolerated usually, and especially people who complain of lactose intolerance, they should be guided not just to avoid milk, but also avoid beverages, health drinks, protein powders, which are available in the market, which have lactose in them. Even biscuits can have lactose, bread can have lactose, confectionery items have lactose. So they have to be educated that these are to be strictly avoided. Small meals are very, very important because your stomach is not in a condition, your GI tract is not in a condition to digest a lot of food efficiently. So we have to take typically small meals at regular intervals, and provide good nutrition to these patients, which will actually help them to gain weight, not fat mass, but muscle mass. So a high protein diet actually helps these people, but the protein has to come from lean sources. So we ask them to avoid red meat or processed meats. We ask them to take fresh fish, eggs, lean meats. They can have curd, they can have paneer. So we tell them, depending on their dietary habits, what are the sources of lean protein that they can have, and they should really build up on that. And there are some patients who also benefit by a gluten-free diet, although it is not a standard rule that all patients with Crohn's will have a problem with gluten, but sometimes patients do benefit if they have a rice-based diet. So this is about the problems which are related to the gut, normally what we go through. Now, what about this concept of gut microbiota I was talking about? We usually do not think about gut microbiota. We do not think about the deeper aspects. We only think gut is a place where food is digested and absorbed, and that is it. We do not think about the other implications that it has a lot to do with a lot of other things. So in this slide, you'll find that to the right, we have these typical problems of irritable bowel disease, irritable bowel syndrome, Crohn's, ulcerative colitis. These can happen if your microbiota is not healthy, of course, but also to the right, to the left, you can see that things like obesity, diabetes, insulin resistance, metabolic syndrome, cardiovascular disease, all these degenerative and chronic health issues can also happen due to an imbalance in our gut microbiota. Basically, gut microbiota is nothing but the bacteria which is living in our gut, and the balance has to be maintained between the pathogenic bacteria and the healthy bacteria. Depending on that, the immune system of the body is also affected, because 80% of our immune system is actually in the digestive tract. So our seniors were not wrong when they told us when we were young that keep your gut clean, automatically you'll be fine. If we keep our guts clean, then automatically our immune system is going to be strong. And all these extra pills and fancy diets, the fad diets that we talk of nowadays, immune enhancing diets, they're really not of much use if you have a healthy gut. So in order to have a healthy microbiota, we want to increase the healthy bacteria, and we want to keep the pathogenic bacteria under control. What do we do? Of course, we have to eat on time. If you do not eat on time, if the gut is not getting food on time, then what happens is these pathogenic bacteria, they start ruling our gut. They can actually pass into the bloodstream and create havoc. So in order to keep them under control, the gut has to be given food at the right time, in the right proportion, so that it works properly. And there are certain things we can actually act as food for the healthy bacteria. We can help the healthy bacteria grow. How? By having probiotics. Probiotics are actually live microorganisms which are found in fermented foods. Your idli can have it, your sattu can have it, your curd can have it. All these fermented foods, they have natural live bacteria which can actually help to restore the healthy gut bacteria. Or along with that, there is another support therapy I can give to the bacteria in my gut. That is by giving them the right fodder to grow. These are called prebiotics. Prebiotics are nothing but different kinds of fibers in the diet. So if the person is having a lot of fiber, the right kind of fiber in the diet, then automatically the gut bacteria, the healthy bacteria, they have the right ambience to grow. So keeping our gut clean, not having constipation, taking healthy food, avoiding inflammatory triggers, like I said, sugar, processed items, fried items, foods with preservatives, automatically these things will help the healthy bacteria thrive in our gut. And what is going to happen is a symbiotic action. The probiotics and the prebiotics, together they will give what is known as a symbiotic connection. They will act together and we will have a healthy gut. So in order to restore the gut health, we have what is known as a 5R protocol, 5 rules which we have come up with. This is essentially for people with IBS, but it's applicable actually for everybody if you want to have a clean gut. First is removing the stressors and gut irritants. It can differ from person to person, but we have to find out what is causing the stress. Remove the stress, and also the foods or the preservatives or the harmful chemicals, the additives, or even things like sugar, excess saturated fat, trans fats, which are acting as gut irritants. We need to remove it from the diet. Next is we need to replace the gut with healthy nutrients, with bile and stomach acid. So we are basically cleaning the gut and then replacing it with healthy stuff. In our system, liver is a natural detoxifying organ, followed by the kidney. Some people believe that this detoxification of the liver, it is done every day. And the liver actually starts detoxifying our system around 11 p.m. at night. So what happens is that if you have an early dinner, if you have eaten healthy throughout the day, and you have given the right nutrients to your system, then the liver will do its work very well. You get a good night's sleep, your liver detoxifies your system, and you wake up feeling fresh. But for those people who stay up late at night, who have the habit of having a very late dinner, they do not digest their food by the time it is 11 o'clock. So the liver does not get the chance to detoxify. It is like a housewife who has served dinner to her people and now she's cleaning up the kitchen. So similarly, our body also needs to, our gut also needs to clean up the system. If you eat your food on time and you have the right kind of food, automatically you're giving the liver the time to detoxify your system. So automatically, this first process is being done by your liver. Half the work is being done by the liver, by detoxification. So then I replace it with healthy food, and we can also follow up with the third step, re-inoculation. That is helping the healthy gut bacteria thrive. Put in the probiotics in the diet, follow it up with the prebiotics. So I'm actually hand-holding the healthy friends that we have in the gut. The fourth is repairing the intestinal wall. We hear of problems like leaky gut. If the gut is not getting food on time, if you are not eating for a very long while, the acid in your system automatically will erode the gut. You hear of people having ulcers, leaky gut syndrome. All these are because we are having the wrong kinds of foods, and probably we are not giving the proper time to the gut to digest and absorb the food, or leaving it empty for long. So the bile and the acids in the stomach, what they are doing, they're trying to auto-digest the stomach itself, and that leads to ulceration, and the intestinal wall also can be impaired. So by repairing the intestinal wall, by keeping an intact intestinal wall, we can actually prevent harmful pathogens from entering our system. So that is one very big step in order to boost up our immunity. And the last is rebalancing. The entire lifestyle has to be rebalancing. We need to find out what is good for us, a healthy diet, proper exercise, de-stress ourselves, and work towards an overall holistic well-being. So that is the concept of the 5R protocol. So the summary of my talk today: a balanced diet with proper hydration is excellent for everybody, and the best way in which you can keep a healthy gut and repair any problems related to gut. Restriction on sugar, processed items, food additives, and preservatives, because these are actually, they act as the stimulants. They produce a lot of free radicals. They actually damage our system. They damage our immunity. So by restricting these in our diet, automatically we are going to remove the stressors which we are providing to our gut if we do eat them. Eating on time and eliminating non-nutritive items. Non-nutritive items typically mean things like alcohol, excess sugar, salt. We do not need them in excess. They just pile up on calories. They do not give us any nutrition. So eliminating these non-nutritive items and eating on time will also give a big boost to our gut. Good food hygiene. We do not want any pathogen from outside. And staying away from food fat is again very, very important, because now people are very, very confused. There are lots of fad diets in the market which say if you do this, you'll have a wonderful gut health in 7 days, or this works as magic for your gut. There is no magic in it. It's just inculcating healthy habits over a lifetime, eating good food, a balanced diet with proper hydration. So we go back to what Hippocrates has told us: let food be thy medicine and medicine be thy food. By this process, if we really think of food to be therapeutic, in that case, we can eliminate half the problems that we have. Of course, we can keep our gut healthy. And as our elders had told us, as Hippocrates had told us, that the disease will not begin in our system because your gut is healthy. So with that, I end my talk today. Thank you all for your patient listening.
Thank you, Sanghamitra. May I request IT to open my video, please? Make me co-host.
IT?
Yes, sir. Done.
Yep, thank you. Thank you. You all will agree that Sanghamitra has done a great job. The way she has explained. We always thought as a doctor that the dietitian role is a very, very supplementary role to clinicians. After listening to her, I realized that things have turned topsy-turvy. What should have been our mainstay? I think we all should have stayed poor. The staying poor is probably the best way of staying healthy. Then you don't buy processed food. You don't eat too much of sweets. You eat kind of pork curd, more pakhal bhat, pantha bhat, more fermented food, and you would have been healthier. Because what is emerging very clearly, that the biome, the microbiome decides your immunity and also decides, I mean, I have heard recently that all those post-cancer therapy, those who have a better microbiome, their response to the immunity is far better. And they recover from therapy far better, they have less complications, and they turn out to be healthier. And you would agree that Sanghamitra has done a great job. Now, and she has put it up very succinctly, very clearly, very lucidly, that indigestion, what is indigestion? She has said very simply, eat food in time. Don't eat food, give gap. Don't allow food to be eaten in bulk. You eat small meals from time to time, stick to your timings, and you'll be healthy. You'll never have indigestion. You'll never have a gas. You'll never have the bloated stomach. You'll never have pain. You'll not have a gastroesophageal reflux. If you eat food in time, if you avoid caffeine. She also said that those who drink a lot of water with the food, they kind of create a slush in the stomach. So acid is less, food is like a slush, and they don't stay healthy. So it's a very, very simple. She said that diarrhea, she cautioned us, don't stop eating, especially in elderly. The problem with elderly is that the moment they have a diarrhea, they stop eating. The moment they stop eating, they don't get nutrients, they don't get water, and their sodium potassium changes, they get restless, they get kind of into a mental syndrome, and they become bad to worse. So continue eating something, but what should be eaten? She clarified that eat curd, eat rice, don't take heavy food, don't take fat, don't take protein, take food which is low in fat, take nutrients, take non-soluble fibers. Avoid non-soluble fibers, take soluble fibers. Soluble fibers means apple and pear, which gets digested, and the fibers are not very hard to digest. Otherwise, if they're hard to digest, when they go to large intestine, the bacteria start working on that, but it's undigested, and again gives you discomfort. Then she said constipations that have lots of fiber, you are allowed to eat as much as you want to eat. He said IBS, inflammatory bowel syndrome, depending on what kind of inflammatory bowel syndrome you have, constipation type or diarrhea type, say avoid inflammatory triggers, sugar, and fermentable food, large insoluble fibers, because they will get fermented in the large intestine. She also said that these people normally don't tolerate cabbage, radish, मूली, गाजर, ये सब खाने से इनको गैस होती है, इनको तकलीफ होती है, अवॉइड करें. अगर जिसको आईबीएस में कॉन्स्टिपेशन है, वो कितना चाहे उतना फाइबर खा सकता है. इन्होंने कहा डायरिया में ईट स्लोली, अवॉइड chewing gums, those who have got IBS of diarrhea type, alcohol, caffeine, high fat food, dal. She said take soluble fibers. Again, apples, beans, oats, carrots and oranges are good soluble fibers that are good for you in diarrhea. She said that FODMAP, I never knew FODMAP. This is the first time I heard Sanghamitra, FODMAP, and when you told us and taught to us. Last time I remember Dr. Sethi also mentioned, but I couldn't get it that time. Now when you mentioned it so beautifully, then I realized that, and the best part you said that in IBS, if you eliminate all food and induce food one by one, step by step. It's a great way of knowing which food suits you. And then accordingly, you can really zero on a good food. That's a huge change in life for the IBS patient. He said that stress की वजह से IBS बहुत precipitate करता है. तो हम लोग को stress बचाना चाहिए and be careful about stress. And before I come to your last slide, which is fantastic, the prebiotic and probiotic. What are the good source of prebiotic? Prebiotic, what you said, if I remember correctly, is that food which feeds probiotic, which feeds good bacteria in the intestine. And those good bacteria are good for immunity. What is truly a prebiotic? What are they? Give us very commonest example of 5 food.
Fruits like your apples, grapes, bananas, nashpatis, all these are good prebiotics. Cereals like your oats, they will give good prebiotics. Onions are a good source of prebiotics. So basically fresh fruits, vegetables, whole grain cereals, they all act as prebiotics.
And probiotic?
Probiotic is the actual fermented food, the actual live bacteria. So things like your fermented food items, like your idli, or it can be sattu, dahi, the Bengal, rural Bengal, panta bhat, all these things, they are already, which have already been processed, fermented. They have the live bacteria, that is probiotic. In Germany, they have something called sauerkraut, that is also kimchi. These are all probiotics. They are already fermented. So the bacteria is there in them.
Okay, thank you very much. And I'm going to end my today's session by the 5 R's which she mentioned. Say remove stress and gut irritants like sugar and etc. Say replace nutrients with the stomach acids. She said don't dilute your acids and let them be there and in adequate quantity. Eat in time so they have time to act on your food. Re-inoculate by prebiotic and probiotics, repair the intestine wall. She said, if you just eat food in time, schedule food which you used to eat regularly. If you have breakfast at 8 o'clock, stick to 8 o'clock. If you have lunch at 1 o'clock, 1 o'clock. If you have dinner at 8 o'clock, 8 o'clock. Don't change timing. Don't give a huge gap. When you give a huge gap, then all the leaky intestine theory comes in. It becomes active. And she says, rebalance. Rebalance your lifestyle. Eat healthy. Eat vegetarian and eat as much as plant-based diet. If you can replace your diet mostly with a plant-based diet, whole plant-based diet, vegetable diet, fruits, your chance of staying healthy is far, far more. There is tons and tons of research which says that those who eat processed food. Now let me explain here what is processed food. The food which is in natural form is a natural food, unprocessed. Anything you do to that food, like if you roast your peanut, it becomes processed. You further process it by cleaning it like rice. Some of she said that Shiddho Bhat, Arba, Osna Bhat, we call in Odisha, the brown rice, the unprocessed, right, has not been polished. The moment you act on a food to make it more palatable, you remove the nutrients. And what they do to make it highly processed, they add sugar in it, they add sweetener in it, they add salt in it. So the original food has disappeared. For it to become tasty, it become processed food, and that hurts you like mad. Nothing hurts you more than the processed food. Please stick to the natural fiber, natural food, natural vegetables. Stay healthy. Thank you. Have a nice weekend. Thank you, Sanghamitra. You have educated all of us hugely.
My pleasure.
Thank you very much. And I hope that people take a lesson back that probably the best diet is vegetarian diet. Thank you. Have a nice weekend. Thank you.